Hi, welcome to EMDR with Alice. So today I wanted to talk just a little bit about understanding the expectations of processing trauma versus attachment wounding and even grief. So I just want to take a moment just to kind of talk through that because this is important conversations that you want to have with your clients so that everybody's on the same page and has realistic expectations of outcomes. So remember that EMDR, the basis of EMDR and the model has been shown that is very effective with PTSD and trauma. And that's what it's most widely been used for. That was the origin of the use of EMDR therapy, what all the literature is on originally with EMDR therapy. And so we know that with trauma, especially more kind of single incident based traumas, there can be rapid shifts and changes and rapid dramatic changes for clients, even elimination of symptoms, if not elimination, at least a pretty significant reduction in symptoms. So oftentimes clients can come to us because they've heard that, but they don't quite understand that maybe if they have more complex trauma or attachment-based wounding, that experience might look different. So yes, for single incident type trauma, and even single incident type grief without complications, there can be a pretty rapid decrease or elimination of symptoms. However, if you're working with a client and there's attachment-based wounding or complex trauma history, then the expectation is that EMDR can be really helpful and even very effective. However, it's going to be slower. The symptoms may be more reduction versus elimination. And I like to tell clients too, you may notice it more as shifts, like subtle shifts that kind of are real gradual or even sometimes go unnoticed versus the dramatic shifts that can happen with single incident based trauma processing. Same thing with grief, single incident kind of grief, even if it's big traumatic grief experiences, can have pretty dramatic shifts and changes for individuals where they can feel drastically different after some EMDR sessions around that loss versus working with someone who has attachment-based wounding with the person that they've lost. Then those grief reprocessing can be, again, more subtle. The symptoms may not be as dramatic in terms of reduction. They may even not notice as much of a dramatic shift as you would with those single incident grief without complications. So talking through with clients, because oftentimes I work with clients with both complex trauma and single incident trauma. And what I'll often talk to them about is, okay, so with the trauma processing that we're going to do around some of the single incident, you're going to notice a big dramatic shift. And oftentimes we'll do that reprocessing. They'll be like, this was amazing. I have some other stuff I really want to work through. And then they start talking some about their childhood things that they want to process and work through. And I'll say, well, we can definitely do that. You may not experience as dramatic of a shift as you did with like this most recent event that we just processed that was more traumatic and single incident based. So we can definitely do that. However, it might feel and you might experience it different. So having those conversations, setting those clear expectations is important, both for the therapist to understand that and for the client to understand that before you move forward in the treatment process. That's it for today. Thank you for joining.